Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to be talking about a condition called distichiasis and ectopic cilia. So distichiasis and ectopic cilia are both conditions where hairs grow in an abnormal place very close to the eyelid margin or from within the eyelid margin. The difference between the two conditions is that distichiasis are basically hairs that come out of the eyelid margin. The lid margin contains lots of little glands. We call those the meibomian glands. And sometimes we see hairs coming out of those gland openings, and we call that condition distichiasis. Ectopic cilia is different. So these are hairs which probably come from the same area as distichiasis, but they don't come through the openings of these glands. They actually come out from the inside of the eyelid. Now, when there's a hair on the inside of the eyelid, it starts rubbing on the cornea, and if it rubs on the cornea, it will cause an ulcer, and it's usually a very, very painful condition. So distichiasis and ectopic cilia are both conditions which are most likely genetic. It doesn't mean that it's hereditary, so it doesn't mean it needs to be passed down from mum or dad, but there's probably some sort of a genetic link. So they were probably predisposed by nature to get this condition. And that is due to the fact that we tend to see these conditions more in certain dog breeds than in others, which is why a genetic link is very likely. Yeah, so we do tend to see this condition more in certain dog breeds. So English Bulldogs, for instance, we see quite a lot of those. However, we also see it in other dog breeds such as Bichon Frises, in Cocker Spaniels, in flat coat retrievers, in Labradors. So we tend to see it more in certain breeds than in others, but technically any breed can be affected by this. Well, to a certain degree, usually both eyes are affected, particularly by distichiasis. Ectopic cilia, so the hair from the inside of the eyelid, sometimes only involves one eye, um, but we still check all four eyelids to make sure that we're not missing something that is about to come out, if we end up having to treat that particular condition. So before treating them, what I usually try to do is assess how important or um, how much are these distichia affecting the patient. Ectopic cilia is usually a condition where patients are quite painful and those clearly need surgery to remove that hair. But in distichiasis, not every patient who comes in who has hairs coming out of the lid margin requires surgery. So the first thing that I do is I have a look at the blink rate and see how affected the patient is by that. And then I will have a look at the surface of the eye, the tear film, and make sure that that is all nice and healthy. If there's no obvious signs of any sort of irritation, and if I'm in doubt, I sometimes pluck them out. You usually have to do that under some form of magnification under sedation, and just to check and see whether these hairs are actually causing a problem. They will grow back again if you just pluck them out, but we at this point we just want to assess whether or not they're actually significant. And then once we've established that they are significant, there's different treatment options. So there are treatment options such as cryotherapy, so you can freeze the roots of the hairs. That is a procedure done under general anesthetic. There's other treatment forms where you um, put a very, very fine wire into the opening where the hair is coming out, and then create a very, very low voltage to try and destroy the hair follicle, the root of the hair. My personal preferred method of dealing with these is by surgically cutting them out. So cut out the roots, and then pull the hairs out from the inside. So I know that that particular hair is not going to come back again. However, all of these treatment options have a risk of recurrence, which means that the hairs could potentially still grow back in other locations, even if you remove the ones that were present at the time. And they can also have negative impact on their tear film and the tear film stability. So that's why I personally don't tend to treat every single dog with this condition, but I want to be sure that it's actually causing problems. Also, if you have a patient with very, very thin eyelids and lots and lots of different hairs coming out, we see that in Shih Tzus in particular. I'm going to be very cautious at removing those because the mechanical trauma of doing the procedure can actually be worse for the patient than the actual underlying condition was. So that's why I'm very cautious with treating these patients. So, like I said, not every patient needs surgical removal of these hairs. There are some patients who live a very happy life without any problems. Ectopic cilia is probably different. Most of these patients will have discomfort, and they will probably also have ulcers. So those hairs usually need to be removed in order to improve comfort levels. But with distichiasis, if they're causing problems and they're ignored and not treated, they can also cause ulcers. So they're not completely benign. Um, but if they don't cause problems, um, they might never cause problems during the patient's lifetime. So hopefully you found this video informative, and if there are any comments or any questions, please feel free to put them in below. Thank you. Bye-bye.